So those sections in the Act, I think, were actually put in there for those purposes in order to get people who are overholding, not the people who actually need long-term care. So what happens now is if the person is needing long-term care but they can't be discharged because there's no place to go, or the places that they're picked are not available because of waiting lists, they're labeled as alternative level of care or transitional care, so ALC, and that's what I'm going to call it from now on. So they're labeled as ALC. And in ALC, the hospital does have the right to charge people, but not $600 a day, not $1,600 a day. It's roughly $50 a day. It's the same rate that's in long-term care, and that's even subject to rate reductions that are in long-term care. And that's in the health insurance legislation. And then you stay in the hospital. Now, the waiting lists for the long-term care, they're all under various priorities. There is a priority called 1A, which is a crisis admission, which means somebody can be placed in any long-term care home. But that crisis admission waiting list applies to people, not facilities. But what we're seeing now in practice is the Ministry of Health and the LHIN are labeling a hospital as 1A, and then saying people can be moved out. Now, sometimes we've used that to our advantage, quite honestly, because then our clients get to the top of a waiting list and get into the home of their choice. But, you know, we've resisted it when the persons are being told they have to go to any bed within the LHIN area. And as Natalie explained, the LHIN areas are gigantic. So again, think of the impact on a low-income family who can't travel. Now, in the hospital first available bed policies, are those appropriate? Can a hospital force transfer of a patient to an available bed? No, unless that patient consents, they can't force the transfer. Can they ask the patient to consider that choice? Yes, that's reasonable. Sometimes beds come available, the patient and their family haven't considered that option. It's quite reasonable to talk to the patient about that as an option. But again, it has to be the patient's choice. What we're concerned about is people being forced into choices that they don't want under threats of the high per diem. Now selection. Why do people select different places? Variety of reasons. Not all long-term care homes are the same. Some of them are very problematic, and we've been going after the ministry to do the cleanup on those places that have a lot of infractions, but that's why people don't choose some of them. People also are looking at in long-term care, you're going to live there probably for the rest of your life. So you want to be able to have access to family and friends. And if that's 200 kilometers away or 400 kilometers away, you might as well forget it. You're not going to see the family and friends. What kind of quality of life are you going to get from that? And quite frankly, I think when you're talking about that kind of separation, as Dr. Dawes says, you lose what is the essence of care, of having the family and friends supportive around you. And I think it does lead to death. I don't have stats on that, but I'd love to see it. If somebody's ever done some studies on that, of forced transfer. Certainly we've heard that from other jurisdictions where people have been forced transferred and then you find out about the deaths fairly shortly after. Can hospitals charge more than the LC rate? As I've already mentioned, under the Health Insurance Act, I think they're prohibited from doing that. What happens if the hospital bills? Well, our experience when we get involved is that there's a lot of threats. We've had some clients being given the bills, and we send them back to the hospitals, and we say, that's your problem, not the patient's. And I love the letter I got on one file where they said, well, in this case, we're just going to not charge. But everybody else we will. So anyways, now, can the hospital's discharge require patients or ALC to move to an alternative facility awaiting transfer to long-term care, such as a retirement home? I say no, unless the patient consents. And what would the patient need in order to consent? They'd have to know the whole scheme. And in particular, what's the deal? Like, who's providing the care? Is it the hospital providing care? Like, what are the arrangements? What's the level of care provided? A lot of retirement homes do not have registered staff on duty. They usually have a lot of PSWs. They may provide good services to the people who have that kind of level of care need. But if you're needing long-term care, you often much more care than that. Can a hospital say that the retirement home is actually part of the hospital? Not unless the Ministry of Health approves that. And there has to be an approval process. We dealt with a situation at St. Joe's Villa where the Hamilton hospitals were discharging people into this holding tank at the old St. Joe's Villa that hadn't been torn down yet. And it was the long-term care home that was providing the care services in that facility. We could never get proof that the ministry had ever approved that was the hospital. And that has significance. If it's going to be the hospital, hospital's liable, hospital staff should be in there, hospital should be providing the supervision and providing the care. The other problem with retirement homes is just the structure. They're tenancies. They are tenancies. If you keep on thinking it's that apartment building across the street, there's no difference between that and a retirement home. It's just that you also can pay for health care within the retirement home. Retirement homes are subject to the Residential Tenancies Act. They're defined as care homes. The health care is not regulated. It's not supervised. In a long-term care home, there has to be a nurse on duty 24 hours a day. There has to be a medical director. There has to be certain requirements in terms of the fire code, all that kind of thing, just for safety. There's regular inspections. It's not a perfect system, but there's a lot of oversight. When you go into long-term care, you don't have to monitor your own care. It's the facility that has the responsibility to monitor your changing needs and to meet your changing needs. In contrast, in a retirement home, it's a tenancy. You're responsible for your own care. You have to purchase additional care. You have to monitor your changing care needs and make decisions about when you add it on. So there's a whole different responsibility range. So if hospitals are discharging into retirement homes, the questions that come to my mind right away is who's paying for the care? Because if the people are paying a tenancy rate and are paying for the health care, I think this is just bald discrimination on the basis of age and disability. That's not reasonable. Who's responsible for meeting the changing care needs? Again, it's not reasonable if you've got people who are eligible for a higher level of care. Just look at last comment so I can finish off. What's the arrangement? Like I understand in one LHIN, the CCAC is supposed to be providing the care. You know, this mystifies me. Then why aren't they just providing the additional home care to people in their own homes rather than moving them into the retirement homes for that service?
Yeah.
So it just sort of goes around in a circle. Other issues that may come up in the discussion, I'll leave this, but things that recently there was a fire in a retirement home in Muskoka. There's all kinds of issues around safety requirements, the difference between retirement homes and long-term care homes. I don't think it's reasonable to send the vulnerable people to the retirement homes. That's why the Long-Term Care Homes Act, the new act, it's got a very high level of regulation. That's why the existing regulation on long-term care homes are heavily regulated, because it's to take care of vulnerable people and to ensure that they're safe. That's just not in that sector. Does the LHINs have the authority to change the law? No. They have other authorities that you heard about yesterday, but they can't change that basic legal structure. And that's what we're starting to see. We haven't had any cases yet where I've been able to pin that down. But if the LHIN is making an order on something that changes the fundamental legal structure, that's out of their scope of authority. Lastly, I just want to say, can the government change the law and change this legal structure?
Of course.
Yes. They can do that. But I think that means taking it into the House and take it out for public debate. So I'll leave it at that.
So that was, thank you very much, all the panelists. That was exactly what I hoped that each of you would do, and the areas that I hoped you would cover. Rarely does that happen quite so perfectly. And